Hello, everyone. I am Dr. Paridhi Mehra, the founder of Happiness and host for today. Before we start today's topic, I'd like to share some eye opening statistics that have led us to prioritize this topic over others. According to recent studies, 60% of women feel dissatisfied in their marriage after giving birth. Many mothers who have sought support from Happiness have expressed ongoing challenges in their marriage or dissatisfaction with their partner's understanding during the perinatal period. Our own survey has echoed these sentiments with a significant percentage of participants reporting similar experiences. It is clear that the transition to parenthood brings about significant changes in the relationship, and it's important that we address these issues. Our goal today is to uncover the facts and set realistic expectations for couples who are expecting or have recently become parents. To shed light on this very important issue of relationship dynamics after having a baby, we have with us today Himadri Thaplial. Himadri is a clinical psychologist, vaginismus coach, and a perinatal mental health therapist. She has completed her MPhil from National Forensic Science University, Gandhinagar, holds a certification in perinatal mental health care from NIMHANS. Additionally, she is trained in dementia care and is a certified menstrual educator. Beyond her clinical work, Himadri is actively involved in various initiatives, including her role as Vice President Public Service at Wiki and curator at the Global Shapers. She is also a mother to a 14 months old baby girl. Welcome, Himadri, and thank you for joining us today.
Thank you so much, Parity, for having me.
To start with, could you help us understand, the changes in the relationship that couple can expect during pregnancy and post childbirth?
Let us understand the dynamics of what a female goes through when they are going in the perinatal and the postpartum phase. So, if we talk about the antenatal phase, that means when the conceptualization of the fetus, the babies happen. So, the gray matter basically it shortens, right? It decreases in size, literally decreases in size, and at the postpartum phase, it increases. So imagine when I say gray matter, I'm talking about the neural circuits, I'm talking about the neural connections, I'm talking about complete brain chemistry over here. Now,
Yeah.
how to deal with that when a person is not aware about it? When a person is completely unaware, especially as a mother, if somebody is not from psych background or not from a medicine background, right? They don't know that this thing is happening inside their body or in their brain. And it becomes really confusing for them, hence becomes very confusing for the partner as well, because when the person who's undergoing all that is not able to understand how, and they will not be able to express it as well because it's something unknown to them,
Hmm.
especially in primiparity wherein you are giving birth for the first time. That really becomes crucial because first time all the changes are happening to you, to your body, to your mind, and the partner. This is something that really is important to identify and highlight over here, that even partner undergoes a lot of changes, not only
Hmm.
physical but physiological as well. A lot of instances we have seen that if a female is gaining weight, the male also gains weight.
Yeah,
This also
I saw
happens.
that. I saw that during my time, so I can vouch for it.
Absolutely, it happens, and people are like, "Oh, why is this happening?" People say that okay, maybe because of the sedentary lifestyle, they're not able to pay focus, but it's not that. It's the changes that are happening in the body and in the environment that has really direct effect on you. Now, talking about when you ask that how it affects people and their relationships. So it affects at various levels. So during pregnancy, Parity, and post childbirth, I think there's a lot of shift in the intimacy. There's a lot of shift in the body changes. There's a lot of shift in how you're perceiving yourself, especially for females, and it directly affects the male as well. So when I talk about intimacy alone, there is a huge shift in libido. When I say libido, it's a sexual energy I'm talking about, right? And the sexual energy goes way down when you are in the peripartum and especially in the postpartum phase, right? For some, in the peripartum phase, it increases, but it decreases simultaneously after childbirth, and it's vice versa for some. For some, it's like the intimacy is out. So when we talk about fathers, the first thing as the couple gets pregnant, the fatherly emotions also triggers, right? So the intimacy takes a backseat. They also have a lot of fear that, oh, what if they hurt if they are getting intimate? And this I'm talking about and in the antenatal phase also and in the postpartum phase also.
Hmm.
Right? Number one. Number two, there are father blues as well. Whether they're going to be good father or not, right? Whether they're going to be a good husband or not, whether they'll be able to provide or not. Then they also feel there's a lot of, like I said, libido change, right?
Hmm.
Sometimes there's a libido decrease in the fathers as well because they get overwhelmed with the responsibilities of the coming child, especially during the antenatal phase. So, providing for the child, care for the child, these all thoughts start coming in, which can directly, hamper the libido in the men. Now, this is where the friction happens between partners and couples, wherein, for one, it's not either the priority or the libido is down, or there could be other environmental factors as well, like the professional constraints, the stress that they're having, or any other mental health issues that they're facing. And it could be the same for the female as well, both during antenatal and for postpartum. And sometimes, even if it is less, it should be very fulfilling in nature. Like you should have other contacts or other forms of intimacy happening so that you don't feel void, you don't feel neglected by your partner, or you don't feel like your needs are not being met. I think this is the most important issue that partners face or they have from each other, that their needs are not being met or it's not being understood by the other partner.
Yeah, I think that's really new for me also, because many a times mothers come to us for support, or it could be even the fathers. And one of the things that they mention is that they're not sure if everything is working out or not, because maybe they were more sexually active before the child, before the pregnancy, or sometimes many of them even come during pregnancy and they are not sure how it is going to pan out. Many parents come to us with similar problems. They are not really sure, while they are already overwhelmed with all of the responsibilities of caring for the child, but they just feel lost in their own relationship, because they were not really prepared for it. They thought that it is going to remain same, but nobody told them that there are going to be changes in your own relationship. It could be time constrained, of course, not having time for any kind of intimacy is one aspect, but even time to sit and talk to each other peacefully for a few minutes, that too is sometimes is a luxury for new parents. Talking about that, how can parents and how can couples be better prepared for the changes that come with pregnancy, the changes that come with childbirth?
I think to be better prepared is to have a plan in hand. That means what are the ways? It could be, the checkups. It could be your lifestyle. It could be your routine. How to mingle, how to take out time, when to have quality time. If you're working 5 days a week, 6 days a week, 7 days should be your time, right? So managing that is number one, very, very important. Um, Expectations of the partner needs to be communicated, especially in the peripartum and the postpartum times. Peripartum times, because the female needs more rest, the female needs more attention because of you're growing a baby inside your womb, so everything heightens up, and the first trimester is really, really difficult. So that's where the partner perspective really, really comes in. That's how you can be more prepared, taking on responsibilities, shared roles. If you have support system or social support system, it could be friends, it could be family, it could be your physicians, it could be obs, gyne, anybody, having proper thorough understanding, going for counselings together, going for scans together. I think all of those really helps you prepare for what's coming next. When you're facing things together, you feel that you're a team. You need to understand, you need to have more insight, read about it, maybe go for counselings, get in touch with the psychologists, psychiatrists, or primary caregivers, who know these things better and understand that these are the symptoms of it, you know, and then manage your ways out, understand, have insight, introspect, because it becomes very difficult for the female alone to handle all of this. So
Yeah.
it becomes, and it's very difficult for the partner as well, let me tell you. It's like you already have a baby at home and they don't know what's happening to them. And it's very, very chaotic for both the partners. Hence, very, crucial to just be a team.
I think you've made a very valid point where you mentioned that yes, changes are going to happen, but if you are mentally prepared for it, if you set the expectations right, because many a times what happens is, and it's very common that you know, couples are all preparing for the baby, but they are not really sure what will happen to them after the child comes into picture, or that's not a thing that comes to their mind. But suddenly when the child comes into the picture, they have no time for each other. um, we talked about, yes, changes in libido, all of that is one thing, but you know uh, not being prepared for this is something that really puts the relationship at strain. And then you mentioned about teamwork, that it is not the mother who's pregnant, but it is both the couples who get pregnant together. So you have to
Absolutely.
prepare accordingly. You have to set the expectation right. You have to educate yourself. For
Right.
instance, at Happiness, we have something called as preparation for pregnancy, where we counsel the couples, tell them what to expect, how their relationship is going to change. How can they continue to work on their relationship even after the baby comes into picture.
Right.
So that's I think a very valid point. Now, talking about expectation setting and making time for each other, what according to you are some of the proactive measures that couples can take to make time for each other and stay strong during this change?
Okay. So I think first and foremost thing, in order to spend time with each other, I think the essence of being a human is the communication, right? So if we are talking, things feel fine. If we are not talking, then that is something we're wrong. I'm not saying that being quiet or being an introvert, that's the nature of personality. I'm not going there. I'm talking about expressing, and it's not just communicating, it's like positive, valid communication I'm talking about. Like, what are you
Hmm.
feeling? How are you doing? How was your day today? Not just asking about the baby or
Yeah.
just the health. Overall, how are you doing today? How was your day today? What did you do today? Are you feeling all right? Can I do something for you? Right? Do you need my help? Do you need some alone time? Other ways to strengthen your relationship is intimacy, like I said. It's very important part of it. As soon as like small peck on the cheek, to kiss in the forehead, um, hugging. I think that we often try this in somatic therapy where when a child is crying, no matter what the reason the child is crying for, and if you hold the child and if you hug the child will calm down. That's how the human beings work. So I think as we grow up, I think adults we have forgotten the charm of somatic healing and the touch. So I think hugging your partner, sitting close to them, maybe just when you sit together, just give each other a foot massage, just gentle caressing also works. You know, I have seen a lot of clients when they come for couple therapy, and over the time, when they sit together, they are touching each other, they're touching each other's ring, and it really makes them feel good and seen. It feels that even though I've seen so many couples, they sit together and in a gathering and they're holding each other's hand. A lot of times, people feel that it's not okay to do that, but they don't know their history, how far they have come. So when they do that and they tell me in the sessions, so it's really, really productive for me. So I think this is something that people can do. That means small gestures of love and intimacy, not just sex. I'm talking about intimacy as a whole. I think that's very important. It could be acts of kindness to maybe like cooking something or maybe getting a glass of water, something that makes the other person feel happy and you know you feel that yes, I'm being seen and heard. I think that's really, really important. Also, it's important to understand that you are one team, like I mentioned earlier. So there will be ups and downs. There will be days wherein you're not on the same page. Maybe one is more frustrated, the other is more stressed out, and you both don't have time to be compassionate towards each other. I think that's where effective communication again comes into play. Taking a pause, giving each other that space, right? And coming back together, not with the egos that, you did this and you said that. I think it's coming together collaboratively and expressing your needs.
I would also, like to add from my side here. I mean, being proactive, understanding that, your relationship cannot take the back seat. Of course, the priority is going to change with the baby. Both of you are going to, just keep thinking about the baby, and many a times just keep talking about the baby. But I think giving yourself that even half an hour. every day. uh, Either you're just sitting together asking each other about how the day was, or or making some time. Either it could be, it's difficult after a child. For instance, in my case, we used to go for date nights before obviously we became parents, but after becoming parents it just became so difficult. um, so we switched, and this was after a long time obviously, but then we figured out that something needs to be done, and we started planning date lunches, because that's when the help is there. That's when there are family members who can take care of the child. So even if it means 1 hour, just both of you talking to each other, not talking about the baby, but just both of you being present in the moment, I think that really helps. So I totally agree with whatever you mentioned, different ways of intimacy. It the sexual desire may go down. You may not have the time or the energy for intercourse, but take time to just be with each other, be in the moment, and just be there for each other as a team. So, one last question. We've talked about relationship changes. We've talked about how to work, how to be more present, and how to have the expectations right. But what to do if things are not working out? And when do you think they should seek help for their marriage?
So, first question, when it is not working out, what to do? Identify the signs and symptoms. How to identify? It's very, very simple, very baseline thing I'm going to tell you. When you are not being your authentic self as you were in your relationship, right? That means excessive mood swings, excessive irritability, excessive unknown responses to stimulus and situations where you could have responded very differently. That's where you know that something's not going fine. These are the signs and symptoms that I was talking about. That understanding where you are not being your authentic self, where things are changing, where there's a difficulty in adapting and adjusting. There will be not a lot of new roles that will come up when the baby comes. But as couple, as partners, is there a lot of things that have changed? There's no communication time, no intimacy, and you don't take interest in all those things as well. That's also a mark indicator, right? So this is where you need to understand that yes, something is not right, right? Also, a lot of fights, a lot of hustling, a lot of issues, passive aggressive behavior, wherein you're holding grudges and you're not speaking, and then you're blaming the other person. That very commonly happens postpartum also. When I say postpartum, I'm talking about both the partners, like in marriage, and overall, yeah, scenario. So this is one thing that you need to understand, that this is not working out. If really things are very, very decrepit or they're not working out, I suggest you go for help. When I say help, I'm talking about individual therapy. I'm talking about family therapy. When I say family therapy, family interventions, individual interventions. There is also couples and social support system interventions as well present, right? Wherein you provide, uh, support to the primary caregivers and the helpers of the primary caregivers. In Indian context, I'm talking about the grandmothers, the grandparents, uh, aunts and mausies and everybody else over here. They also need some counseling. Why? When they're nurturing the child or when they come into that family, right? They also bring their own blues and they also bring their own context into it. Now, this is where the friction can increase. So that counseling also happens. This is where you have to start, seeking help, and you need to start working on it.
I think that brings us to the end of today's session. But I think all the points that you've mentioned are going to be really helpful for both expecting and new parents, because right from how you mentioned about the changes that happen, how to be prepared for it, how the pregnancy is not just mother getting pregnant, it is the family who gets pregnant. So the entire family, both the partners need to be there. And then how to make time for each other, how to acknowledge that something needs to be done about the situation, how to be proactive in it. And finally, you mentioned about the signs and symptoms, how to understand that there is an external help which is required. There's also a lot of stigma attached, like with maternal mental health. There's also a lot of stigma attached with couple counseling or marriage counseling. Um, but I think with becoming new parents, all these changes are very common. And if counseling can help, why not?
Correct.
Right? So it's really important to understand when to seek help, when to, how to work on your relationship and how to make time for each other. So I think with that, we'll end today's session. But thank you, Himadri, for sharing your insights on this very crucial topic. To all the parents out there, remember that the journey of parenthood is a shared one. It is important for both partners to share the responsibility and enjoy this phase together while also supporting each other. Embrace the happy times and stand by each other during the tough ones. With love and understanding, you can face any challenge and build a strong family together. And if you are expecting, be sure to explore the counseling programs available at Happinest. These programs can provide better guidance and help you better prepare for the adventures of parenthood. Thank you for tuning in, and thank you so much, Imadri, for joining us today.
Thank you. Thank you for having me.